We've talked about cancer before. Let's talk a little bit about hyperthermia. I think we've all heard about hypothermia and what that is. Can you talk about what hyperthermia is, first of all?
Yes, hyperthermia is using heat, using elevated temperature as a method for treating cancer. Hyperthermia, is one of the most ancient methods of healing. It was used thousands of years ago in every medical culture. Greek culture, Ayurvedic medicine, which uses it a lot, Chinese medicine, in naturopathic methods. It was very simple. You went into a hot bath, and it increased your body temperature, and it had healing effects. It has very unique use in the field of cancer. And we can look at this in some greater detail and see how is hyperthermia used in cancer. First of all, there are two basic categories of hyperthermia. One is local regional hyperthermia, when we produce heat to a certain area of the body, and one is systemic whole body hyperthermia. In Germany, whole body hyperthermia is an established method for treating cancer. In fact, it's paid by German insurance. They pay for every hour of hyperthermia. And it's very widely used. It's used on its own, but it's especially effective with other treatments. Now, how is it used? There are three different levels of hyperthermia. One is a very mild hyperthermia, which is between 37 centigrade and 38.5, between 98.6 and 101. And this level of hyperthermia that you can get when you get into a sauna, into an infrared sauna, into a hot bath for a short time, helps detoxification. It increases the blood flow, there is sweating, and you get an effect of detoxification. It is not warm enough to affect the immune system. The second level is called moderate hyperthermia. It's from 38.5 to 40 degrees, from 101 to 104, 104.5. It's the fever level hyperthermia. Sure. And this is the one that can already affect the immune system and change our metabolism. And this kind of hyperthermia is very useful for cancer, because cancer metabolism is different than the metabolism of regular cells. And the last category is the extreme hyperthermia, which is 41.5 or about 106 degrees, done only for an hour and a half. That's a very radical hyperthermia done under intensive care unit environment, and even in Germany done by very few places. It's safe when done in the right place, but obviously it can be dangerous in the same time. So the most popular hyperthermia is a fever level hyperthermia.
And how are those achieved? You talked about the first level just by going into a sauna or a hot bath. How are the other two levels? When you get warmer, how are they applied?
The fever level and the extreme hyperthermia, and the extreme really is extreme, and I don't like to talk about extreme, so I don't recommend it. But let's talk about the physiological fever hyperthermia. It's not readily available in the United States. It's very popular in Germany. It's more a question of having the right equipment here. You go into a bed, it's an infrared bed that is closed, and there's infrared light, and you actually get warmed up. You have a rectal thermometer that checks your temperature. You get intravenous hydration. And if you work with sophisticated doctors, they can run different intravenous therapies like high dosage vitamin C, high dosage vitamin C plus K, and different nutrients that can manipulate this unique situation of high metabolism. And why? Because cancer cells, most cancer function through a principle called the Warburg effect. Anaerobic glycolysis. They produce energy through moving glucose into lactic acid. They don't go into the mitochondria. It's a very inefficient way of producing energy. 2 molecules of ATP instead of 36 when you go through the mitochondria, but you can do it very quickly. So the cells, when they do it, produce a lot of lactic acid, a lot of acidosis, and also a lot of oxidative stress. And because the antioxidant mechanisms are not well developed in the cancer cells, they are more susceptible to heat. So if you can increase the metabolism, and you also can increase by heat, and you increase it by giving certain nutrients, and you do it in conjunction with something like chemotherapy, it is putting additional pressure on the cancer cells, you will get enhanced effect. And I've seen it. I just finished a tour with Dr. Ralph Moss. We visited 7 major hyperthermia clinics in Germany and Austria. And across the board, at least on the acute setting, you definitely see a different response. You see response in patients that don't respond to the same chemotherapy without hyperthermia. So I think it's a wave of the future.
So basically, hyperthermia weakens the cancer cells, and it leaves your other normal cells alone. Correct?
Exactly. And also heat enhances the immune system by producing something called heat shock proteins, which is not the topic of this discussion, but you want to make sure they don't rise too much, and there are certain supplements like curcumin and quercetin that will protect from the possible damage of heat shock protein. So that's one category. The other category is local regional hyperthermia, where you sit on a bed, and certain area there are prompts above your body and under you within the bed, and through radio frequency you hit the specific tissue, and there is an affinity to the cancer tissue, and you hit it up to 106, 107, but it's very localized. It's just for an hour and a half, and the patient doesn't feel anything. It's very easy.
And that would be used for what? A cancer that's in a very specific region? Or?
Yes, it will be used for a cancer within a specific region, or for example, if you have liver metastasis, it can also be used with radiation therapy. It enhances radiation therapy, which is well published. For some reason, it hasn't been happening in the United States. There's now some equipment that has been approved in the United States, but I don't think it's as good as the German equipment, the Oncotherm. But the real way to use hyperthermia is to combine both, the local and the systemic. The systemic is probably more important than the local, but it's more complicated to do.